Identify the boundaries of the infratemporal fossa. Maxilla. Parietal. Sphenoid. Frontal. Z. Lot. Pterygoid plate. Pterygomaxillary fissure. Infratemporal fossa. Boundaries. Lateral equals ramus of mandible. Anterior equals maxilla. Medial equals lot. Pterygoid plate. Roof equals sphenoid. Identify the muscles of mastication, their sources of innervation and their major actions in chewing. Temporalis. Masseter. Medial pterygoid. Buccinator. Lateral pterygoid. Innervated by facial nerve. Temporomandibular eminence. Articular disc. During jaw opening, the mandibular condyle and articular disc glide anteriorly onto the temporomandibular eminence. This is brought about by the action of the superior head of the lateral pterygoid muscle. The temporalis, masseter, medial pterygoid and the inferior head of the lateral pterygoid all participate in jaw closing. Side-to-side grinding is produced by cooperative actions of one masseter and the contralateral medial pterygoid. Follow the course of the major nerves supplying structures and passing through the infratemporal fossa. Identify the parotid, submandibular and sublingual salivary glands. Trace the course of their innervation and follow the flow of saliva from each gland to the mouth. Inferior alveolar N. Lingual N. Facial N. Submandibular ganglion. Otic ganglion. Lesser petrosal N. Chorda tympani. Auriculotemporal N. Innervation of the lacrimal gland. Greater petrosal N. Of pterygoid canal. V2. V1. V2. Facial. Deep petrosal. V3. Pterygopalatal gang. Sup. Cervical gang. Internal carotidae. Trace the flow of blood through the maxillary artery and its major branches. Trace the flow of blood into the nasal and oral cavities. Extension carotid. Inf. Alveolar. Post. Sup. Alveolar. Maxillary. Post. Deep temporal. Ant. Deep temporal. Infraorbital. Middle. Meningeal. Septal BRR. Descending palatine. Greater palatine. Lesser palatine. Sphenopalaton. V3. Trace the flow of air into each of the paranasal sinuses. Note the communication with the nasal cavity, the relationships of each sinus to the oral, orbital and cranial cavities. Frontal sinus. Sphenoethmoid recess. Sup. Meatus. Sup. Concha. Sphenoidal sinus. Middle concha. Ethmoid bulla of middle meatus. Inf. Concha. Opening to maxillary sinus. Inf. Meatus. Sup. Concha. Identify the extrinsic and intrinsic muscles of the tongue, their innervation, and actions. Identify the muscles of the soft palate, their innervation and major actions. Palatoglossus. Palatopharyngeus. Hard palate. Styloglossus. Stylopharyngeus. Stylohyoid. Mandible, cut. Levator veli palatini. Tensor veli palatini. Genioglossus. Geniohyoid. Hyoglossus. Mylohyoid, cut. Sup. Constrictor. Hyoid bone. Palatoglossus. V3. 9. 12. Pharyngeal plexus. 7. Palatopharyngeus.